If 80% of car accidents result in injuries that we call not structural or not surgical intervention necessary, and doctors end up referring those patients from primary care offices and urgent cares to other medical providers, why not chiropractic? Chiropractic care, in about 80% of those cases, is capable of helping these people. So let's go behind the scenes and learn from a chiropractor, an expert in the industry, why it is that so many medical practitioners don't refer to chiropractic when so many people could benefit from it. This is Behind the Bar. Today, I'm with Jason Grimard, the chiropractor that actually treated me when I got in a car accident, and to whom I do with a lot of business with each other. We refer each other a lot of clients, so we work together very closely, and we're able to do that because we trust each other and we know we're good at it, right?
Right.
Jason, thanks for being here.
Awesome to be here.
Tell me a little bit about your background.
So I got into chiropractic back in my undergraduate days. I had a kinesiology professor that was actually a chiropractor. My mom has one of the worst scoliosis that I've was aware of and had known of. And at that point, I was always curious why, when she was growing up, that there was never a conservative treatment that helped her better. So one of the things that I got into was questioning and trying to understand why the medical model back then wasn't able to treat spinal injuries.
And now doesn't want to.
Right. Yeah, and doesn't want to either.
Tell us what's kinesiology and we'll pick up from there.
Sure. So kinesiology is on understanding human biomechanics. So back when I was in school, we got into understanding injuries, movement, proper alignment, things like that, the alignment of proper squat, deadlifts, things like that, the structural things and foundational things that help with movement. But we just dove a little bit deeper into understanding, like, it's all connected one way or another, right?
Well, yeah, you talked about a foundation, right?
Yeah.
You build a house, the foundation has to be square.
Yeah.
Has to be sturdy.
Yeah.
Right.
Got to build it before you can paint it too.
Right.
So,
You don't want your foundation leaning sideways.
right.
So,
Yeah.
so that's what it's about, right?
Absolutely.
So anyway, you're talking about your background. So your mom had scoliosis. You didn't understand why the medical industry didn't have some kind of a conservative treatment for that.
Right.
And so you got into chiropractic. So tell us, where'd you go to college, first of all?
I went to Palmer College of Chiropractic.
Where's that?
Daytona Beach, Florida.
And then you moved back up here.
Yeah.
So actually, folks, maybe this is not the brightest guy on the Christmas tree. I was following the Christmas tree.
Why? Yeah.
Why? Have you looked outside?
I questioned it too many times, but family was back here. I missed the seasons, and I wish I didn't have that.
Do you miss
that
this
voice.
season?
No.
30 inches of snow on the ground. We're going to get more tomorrow.
Yep. So, that being said, New England's a beautiful place 75% out of the year.
Yeah.
So
Maybe like 30% of the year. Go ahead.
Yeah. So just moving back and getting into a practice, I worked in another practice for 6 years that learned a lot of methodology behind, operating a practice and treating patients and treating those injuries that happen over time, whether it be scoliosis or whether it be a car accident. There's different techniques and there's different approaches to all of that. Everybody's different.
And car accidents is where we intersect.
Yeah.
That's where we see each other most often.
Mm-hmm.
And, Jason and I met in a networking group, a business networking group. Well, kind of met in a networking group. We met before the networking group. You shared office space with my cousin,
Mm-hmm.
who, we're not going to have him on the podcast. He can watch us and laugh about that.
Yeah.
And now we're going to have
That's a great intro.
Yeah. And we met each other that way. And I invited you to that networking group. It's been, a few years since then.
Yeah.
It's been great.
Yeah.
So car accidents is where we intersect.
Mm-hmm.
Yeah. And that's where you see, something like 80% of claims for personal injury for car accidents nationwide are, we'll call them the more minor or moderate type of injury claims, not structural stuff. Like you're not You didn't break
No
your arm in 3
referrals, yeah.
places. You're not getting surgical intervention right away. You're not, it's, no major trauma,
Right.
but obviously it can mangle your body.
Yeah. Right. In more ways than I think people are aware of.
So how many years in practice do you have?
Graduated in 2018, so we're going on almost 10 years.
Man, yeah, that happened fast, huh?
Yep.
Yeah. Happens crazy, man. I just started my 15th year in practice. And frankly, I looked at a video of myself and the gray hair on the side of my head and I was like, man,
I
brutal.
do that every morning.
Yeah. All right. So the types of cases that we see most often, like we talked about, car accidents. Obviously, you can help if someone slips and falls on ice, or if there's a workers' comp injury, especially the ergonomic stuff, like what people do when they're sitting in their chair in front of their desk all the time.
Right.
You see a lot of that.
That's a repetitive stress.
Every time I'm sitting in your office, I see those slides go across your screen about
Sitting upright and
people with the phone in their face and what that does. Explain a little bit about that. That sounds really interesting. I love that.
Yeah. So I got into I feel like posture is very much overlooked. Posture and how it affects the structure of the spine and how it affects different aspects of how your physiology works too. So thinking of even a teenager who has the worst posture of the modern era is affected by it. For one, there's studies that show that it affects confidence, it affects lung capacity. So when you think about those things on a deeper level, like how is that affecting that person over time? How is it affecting oxygen that might be getting to his brain or not getting to his brain just because of decreased lung capacity? And we can get a little deeper into that, but or that's a deeper conversation anyway. But looking at how that affects range of motion or function is huge. A person that has a huge forward head posture, so if you're putting your head forward and trying to turn, you lose that range of motion. So my whole goal with people is to restore that range of motion back to normal. But first work on the structure so it can move and then strengthen it into that.
Well, that's where we see it in a lot of people who don't have like sort of physical jobs. They might be sitting at a desk, or even if they have a physical job, and it's like, think about a mechanic working under a hood. Yeah. Or whatever. Yeah. Repetitive use injuries in workers' comp are really common. And I mean, that chiropractic can certainly help with that. Yeah. When we get down to the brass tacks of it, is that a lot of these claims, you're not getting medical facilities to refer patients to chiropractic. And the question I always wondered is why?
Yeah, not commonly.
Yeah, if someone gets in a car accident, they might go to urgent care or their primary care doctor because it's not one of those like super traumatic emergent, I have to go to the ER type of accidents. And then the doctor refers them usually to physical therapy. Or even pain management, where they shove drugs down your throat. Right. Yeah. But hardly ever do you see a doctor who's with it enough to say, well, geez, maybe we should check out this person's alignment too. Yeah, alignment, posture, all goes together. If there's muscle, it's usually connected to a bone, right? Yeah, or it should be. And we hope so. When those bones are connected, all intact, and there's a proper alignment that should be of the spine. So when you have injury to those areas, I'm considering the alignment. I'm considering, how that muscle functions, and not to, PT is never a bad option at all, but I think they work hand in hand together very well too. Yeah, that's been my experience with my clients. I tell you, like I say to my clients all the time when I ask what their treatment plan is, because that's part of the thing I need to know. I need to get medical records. I need to make sure we have all the dates of service and all the billing and everything else. And we coordinate the insurance benefits so that, if they go to the ER and you go to their primary care and then a PT office or a chiropractic office, we get the bills, we make sure the right insurers pay for them. So I need to know the treatment plan. And almost inevitably, it's, okay, I went to my primary care doctor, they referred me to physical therapy. It's, oh, that's great. Well, physical therapy is great because basically they're just building the muscles around the injury, right? That's the whole idea of physical therapy. Strengthening, relaxing, and also gaining range of motion. So a lot of times chiropractic isn't part of that equation, but it should be. Right. Why is it? It might be because they have an associated relationship with one another. I mean, that's usually how it goes, but it's also
part of that model of helping to reduce one area of injury over another. So a lot of people might have a neck injury or a shoulder injury, but how much are those two related? Which is where I see the big picture. So, somebody that might have been injured with a whiplash incident or injury, how is it affecting the shoulder? Typically in PT, or at least commonly from what I've seen in the past, those injuries are treated separately. So they might be addressing the whiplash first and then shoulder secondarily. But
you're a nicer guy than I am. I have a different theory. It's very kind of you, but I have a different theory, and my contempt for insurance companies is very public, and I'm okay with that. But I think these insurance companies are driving these medical facilities to this, and the question is why, right? I mean, they almost require some conservative treatments before you do anything more significant anyway, but they only seem to require physical therapy.
Mm-hmm.
And the question has to be why. Right. And I don't fully understand that aspect of it. Like, why wouldn't they want someone, if they're willing to pay for conservative treatment to avoid unnecessary, more significant treatment later, because of course that costs insurance companies more money.
Yeah.
Then why wouldn't they get someone both to a PT and a chiropractor?
Mm-hmm. I mean, maybe because they want that referral back and forth.
Just the doctor or the PT?
Yeah.
See, I think insurance companies drive a lot of it. Is that your experience too? Like that insurance companies?
Oh, absolutely.
Insurance companies are how doctors get paid.
Yeah.
Your health insurer pays your doctor. You hardly ever pay them out of pocket.
Yep. Yeah, and they're driving the ship.
So. And the insurance companies are driving the ship. And so the doctors want to make the insurance companies happy so that the doctors get paid.
Yeah. Yeah.
And that model means that the doctors are sort of a slave to the health insurance companies.
Mm-hmm.
They're getting prior approvals before they get medicine, or they get treatments and stuff. And so I find it sort of alarming, actually, that more doctors aren't referring their patients for, I would say, preventative care, absent an accident.
Oh, yeah. Absolutely.
Like to go to a chiropractor on a semi-regular basis to, sturdy yourself up anyway.
Right.
Because that's going to avoid injury.
Yeah.
You just talked about the forward headbend, which I have a brutal one.
Yeah.
Right. I mean, that kind of thing. Like I'm just when you were saying, I was like standing up taller in my seat. I was like, maybe I shouldn't be like that anymore.
Yeah. Just being more, creating more preventative space for all these injuries. I think is a huge benefit. Even when I remember seeing a case from another practice, this woman that was under chiropractic care for most of her entire life was in a car accident. We took x-rays on her. Her spine didn't look any different because it was so mobile and so strong that she was able to recover faster.
Because you're not just aligning, you're also, basically you want your spine to be strong and sturdy and malleable.
Yeah.
Right.
Strong and sturdy, malleable, and mobile. And that's the definition of mobility. It's strength under range of motion.
So when you get a traumatic car accident, your body gets contorted all funky.
Mm-hmm.
It's not used to, it's not ready for.
Yeah.
You're able to handle that.
Yeah. And
Tom Brady's famous for this.
Yeah, exactly.
Right? he was famous for having like a personal chiropractor.
Mm-hmm.
Bill Romanowski was the other one, the famous football player.
Yeah.
That did that for his whole career. The whole idea is these guys get basically into 10 car crashes a game.
Yeah. Yeah.
They want
it's all preventative, right? So,
yeah.
If you can get back into a game faster within the week, then you're doing something right?
Yeah. And listen, if Tom Brady does it, like,
he's not going to do it.
He's God on earth, right? For New England today.
Yeah.
Well, for health and fitness anyway. All right. So what we see often in car accidents, and I always found this interesting, the concept of soft tissue injuries. So first of all, can you explain from a chiropractic perspective, what does it mean? A lot of people say it, especially insurance companies love to say it, but they could totally pervert the meaning. What does soft tissue injury mean?
So soft tissue injury means damage to muscle, tendon, ligament, things that you can't see on an x-ray.
Not bones.
Not bones. Right.
So basically anything that's not a bone.
Yeah.
That's an injury.
Yeah.
No matter how serious, is a soft tissue injury.
So despite an x-ray of somebody looking relatively normal, do we know that there's non-inflammation there? No. there's always some form of provoked mechanism that creates inflammation. So, that's something that we can't see on X-ray. If you knew that you had a rotator cuff tear and we took an X-ray of it, we wouldn't know that you had a rotator cuff tear.
Could I have a soft tissue injury?
Because
it's a tendon. Mm-hmm. So like this drives me. It makes me seethe. Yeah. When I'm talking to an insurance adjuster from a car insurance company after a car accident, representing someone was hurt. They went by ambulance to the ER. They followed up with their primary care doctor. They got referred to PT. They did some chiropractic. Mm-hmm. They might be going to see an orthopedic because they just haven't resolved it yet. Yeah. And I'm talking to an insurance adjuster, and the adjuster says, well, this is just a soft tissue injury. Yeah, right. I'm like, oh, is it? Just a soft tissue injury? You mean like every other tissue besides your bone? Yeah. In your whole body?
Soft tissue sounds soft.
Yeah, exactly. So they pervert the meaning of it to try to devalue the claim. Mm-hmm. And unfortunately, so many attorneys in my position buy it. Oh, yeah, it's just soft tissue. So now all of a sudden it's worth less, like it didn't hurt. Yeah. Like it's not mangling you for months on end or years. Right. You could have surgery from a soft tissue injury.
Absolutely.
Right? Invasive, open up your body and fix something surgery. Mm-hmm. Mm-hmm. Or injections to make it feel better. Yeah. And they're like, oh, it's just soft tissue. Drives me insane. But what really means is basically anything that's not bone. Correct. Okay. Yeah. Yeah. Now, and what I always find really interesting is that those types of injuries don't always manifest themselves immediately. Mm-hmm. Can you take us through that phenomenon? Like you might not feel that injury for a day or two or three after an incident. Like what's that all about?
So typically it's adrenaline. A lot of people will get into an accident and get out of the car, feel fine, maybe not go to a hospital or deny ambulatory services.
Terrible idea, by the way. Take the ambulance.
Yes. So that usually, just that rush of adrenaline overcomes pain. So when that adrenaline drops, whether it's days, maybe weeks later, they're in pain, and that pain rears its head pretty aggressively.
It's happened to me. I could speak to it personally. I was in a car accident in October. Mm-hmm. On my daughter's birthday, actually. I got T-boned. I had the right of way. Someone came out of a stop sign. T intersection, hit the driver's side door. Yeah. Didn't see it coming. Didn't have time to react to it, nothing. Mm-hmm. And right after the accident, I was like, okay, I'll be all right. Right. And listen, I'm a hypocrite because I'm always telling anyone who will listen, don't do that. Yeah. Don't do that. Yeah. Take the medical care because you have no idea what your injuries are. You're not a doctor, mm-hmm. right? But right after it, we pulled over, exchanged information, did all that, and I said I was like kind of taking stock of myself. I was like, okay, I don't think anything happened here. I think I'm okay. Yeah. Right.
Then you came down from it,
and then like 2 days later, I was on the phone with you. Yeah. I was like, oh my God. Yeah. My neck and shoulders are killing me. Yeah.
Right. And it'll be a pain that you have probably never felt before.
It's February now and I'm still feeling it. Mm-hmm. That tells you. Yeah. So, I always recommend people get immediate medical care, whether it's from an ambulance at the scene, let the paramedics check you out, if necessary, take you to the hospital, mm-hmm. Or go to an urgent care or an ER on your own.
And imaging is always vital.
And I was going to say, and there's a reason for that. Yeah. You want, from a legal perspective, you want it recorded mm-hmm. by a practitioner, but also from a medical perspective.
Yeah, you want to see what the CT scan is going to show, the MRI, the X-ray, if they're taking X-rays. Were those negative? Did they show anything that was traumatic that caused that hard tissue injury that I need to be aware of to make a plan of care that's proper?
Well, any medical provider would.
Yeah, exactly. Sometimes they might be even overlooked, whether that's the patient denying it, they are not wanting imaging done for whatever reason.
Some people are afraid of our MRI machines. I know one of them.
Yeah, it's like claustrophobic.
It's like putting yourself in a coffin. Yeah. Pretty sure I was buried alive in a previous life. Like I ran my mouth and I got myself in trouble with the powers that be at wherever I lived. Mm-hmm. And I'm pretty sure they buried me alive because I am my biggest fear in this world is in closed spaces.
Mm-hmm.
Like I can't do it. I went to an MRI machine once. That little button they give you. I'm talking about, like, press the button if you're scared.
Eject it. Yeah.
So they put me on the table, slide me into the MRI machine. The second I didn't see daylight, I was like, get me out, get me out. They could not open that thing fast enough.
Yeah.
Oh man.
Yeah, I wouldn't do well either. I can't say that I've been in.
The machine's like right here in your face. It's like on your nose. I have a big nose. So for me, it was on my nose.
Oh yeah.
You know, I was like, wow, this thing is tight. Anyway, I digress.
Mm-hmm.
What are the dangers in waiting? Like, what are the dangers in waiting to get your medical care? Like, that's always a big thing. I mean, I can tell you the legal ramifications of that. I'll go over that in a minute. But like, from your perspective, what are the dangers in waiting to get care?
I mean, you're delaying healing, essentially. So, again, once the adrenaline drops, those muscles tighten up. Why not treat that? And why not gain range of motion back? Because scar tissue is going to develop. If you have a soft tissue injury, you're going to develop scar tissue, whether it be from like some form of calcification on those ligaments or tendons, which is going to ultimately restrict how the muscle and that ligament function. So again, stability is compromised when it's not addressed early on.
I've heard the term scar tissue.
Mm-hmm.
I'm sure people who are listening have too. What is scar tissue?
Yeah, so scar tissue is when you damage a soft tissue, it needs to heal, it needs to stabilize. Your body has a innate response to heal itself. And one way to do that when a muscle or tendon is compromised is to add more tissue to it, but it might not be as functional as, say, a muscle cell or more of a functioning body that might be a part of. So it can usually rear its head as calcification.
Calcification.
Yeah.
Okay.
Yeah.
Doesn't sound good.
No.
Doesn't sound good at all. And what do you see when someone has just a soft tissue injury?
Mm-hmm.
I mean, it's just soft tissue.
Yeah. It's just a concussion.
It's just it just bruised your brain.
Yeah.
You know?
Yeah.
Or, it just tore a ligament. That's it. It's just soft tissue. What do you see when someone, I mean, I talked earlier, I think about 80% of car accidents or more.
Mm-hmm.
Injuries don't include sort of structural stuff that requires surgical intervention or any kind of major invasive treatment. You'd be more on the conservative treatment end of it.
Yeah.
And they would call those sort of smaller claims in the auto insurance industry, which I deal with. Think of it like $50,000 or less in today's day and age.
Mm-hmm.
That type of claim value.
Yeah.
So, about if 80% or so of those claims are below that, and those people are generally only getting conservative types of treatment in a car accident type of claim, like what do you see for healing? I mean, I know it's probably dependent on which part of the body, but let's focus on what most people assume chiropractors only do, which is neck and back.
Yeah.
Whiplash style injuries, which again, insurance companies totally downplay as if they're not significant.
Right.
You get a whiplash type injury, a neck and a back injury from a car accident, you're all out of alignment, your soft tissue injury, and it can be pretty significant. What do you see for treatment time?
Mm-hmm.
What issues do you run in with, medical insurance providers, health insurance providers on paying for those treatments? Yeah. Take us through that.
It's ongoing. So typically, like say a whiplash injury, somebody might be, depending on the severity, because I've seen more minimal to the most severe, where there's actually like broken bones involved. So on the more minimal side, more moderate side, healing usually takes between 4 to 6 weeks. So you can look at care, whether that's 3 times a week for 6 weeks or 2 times a week for those 6 weeks, or a graduation of that from 3 times a week for 4 weeks, and then we drop down to twice per week. But the care itself involves maybe mobilization or trigger point work, not just adjustments, because everybody thinks of the adjustment as like, oh, you're injured, so let's just, aggressively manipulate your neck. That's not the case. because for one, you won't be able to tolerate that. And two, your injury itself wouldn't benefit from it either. So it's more of a gradual, find the range of motion that's comfortable. Let's work with that. I have a couple tools and devices that can promote that.
Pretty cool stuff. It's pretty cool stuff.
Yeah. So
a little gun thing. That thing is
arthrostem.
Yeah. What's it called?
Arthrostem.
Yeah.
You think of joint. And
it's like
yeah. Impact gun for your spine.
I call it a machine gun.
Yeah.
I call it the machine gun. I probably not the correct terminology, but if that's the thing you put on the back and you like up and down the spine, right?
Yep. So it's fit to go right along your spinous processes, which is where you can feel your spine at the skin level, and promoting motion. And with that impact, with that vibration, it brings a stimulus there, which increases healing.
But we talked about, kind of the time period of treatment. That's going to be affected if you don't go 3 times a week. If you go once a week, it's going to take longer, right?
Right.
And if you go twice a week, it'll take longer. If you do 3 times a week and you can shorten your treatment period.
Yep. And I've had plenty of people say, oh, I came 3 times last week. I only need once this week. Well, how would you know that?
You know,
first of all, because you can't get a gauge of what the musculature, the soft tissues really need or want. Right. So that comes back to the clinical side of things. Like, there's a certain time period which your body needs to heal. And if pain is completely subjective, that doesn't account for the physiology of your body either.
And it could be more than 6 weeks, obviously.
Mm-hmm. Oh, absolutely.
I mean, usually with this sort of whiplash injury we're talking about, you might have seen up to 5 or 6 months even.
Yeah. That's usually the beginning stage, because you're just gaining range of motion. Now we have to stabilize, and then we have to strengthen to get the best benefit.
So 4 to 6 weeks, you can sort of heal the injury, but then you have to rebuild.
Right.
And that's where the next, 4 to 6 weeks come from after that?
Yeah.
Right. So, tell me why it's so important to see that through with your chiropractor. I mean, someone always says, oh, geez, I'm feeling better now, I can stop.
Yep.
What do you tell them?
You're not at the point where you can turn your head like you did before the accident. Like, we always do these flashbacks to, I'm still hurt, but I can't. It really hurts to like get something out of my cabinet. Well, that seems like a really important thing for you to do on a regular basis. So let's go back and gauge that and retrain it. Like, they may be out of pain, but doing those certain things that require strength or range of motion, those are the things that cause pain. So looking back at that, giving that person that reflection can be really important.
I can tell you from personal experience,
Mm-hmm.
I think I did 10 to 12 weeks with you. And then we sort of stopped for a while, and that was my mistake, right? I went to go sit at my desk, my bad posture, and I started feeling it again.
Yeah.
Because it's just not ready yet.
Right.
So like, I'm going to have to go back.
Yeah. So you get out of the acute phase, and then it comes into, you ultimately get to the chronic phase. And stabilizing and strengthening are the things that people hate to do. Mm-hmm. Like, in your case, you might have felt good and felt like most of the day was 99% good, but there's these things that some people get into that just don't feel good whatsoever.
Yeah. Well, that's the difference between pain relief and actual healing, right?
Mm-hmm. Yeah.
I mean, there's a difference between the two.
Yeah. Right. And do you want to heal, or do you want to heal and strengthen and improve?
Right. There's multiple phases to it.
Right.
You're preaching to the choir here. I've seen it through, because what people cost themselves for money on the legal end when you're trying to settle a claim.
Yeah.
Or if you have to pursue it through trial, and you self-discharge, as they say, you stopped your own treatment. You said, I'm good.
Yeah.
That's dangerous, because you're costing yourself a lot of money.
Right.
You're giving an insurance company who's already designed with an apparatus in place to devalue your claim.
Yeah.
They're ready for it. And they're just going to make it harder on you to make a recovery.
Right.
Financially. So like, I I tell my clients all the time, listen to your doctor, listen to your chiropractor, listen to your surgeon, listen to whoever.
And show up.
Show up and do all the treatment. I know it's a disruption in your life. I know it's a pain in the ass. Okay? I know nobody wants to leave work 3 times a week in the middle of the afternoon to go do an appointment. But it's all you can get it all compensated. All the time you miss from work is compensatory. You know, all the pain and suffering is compensatory. So you're going to get it back in the settlement. But I tell you this much: you're going to live with the pain if you don't do it. Yeah. And you're not going to get it back in the settlement.
And look at the big.
And that's worst case scenario.
Look at the. I'm going to use 2 different analogies here, but look at the big picture of your entire life. If you're affected this little window, why not treat it to the highest capacity that you can? So if you're injured in a car accident, this is just a little window in your life. Treat it within those 6 months before you're living the rest of your life with some chronic injury or compensation to that too.
Some nagging thing that just won't go away.
Absolutely.
And I'll
see it all the time.
You're recontorting your body to do something differently.
Even these like patients that might have been in accidents 17 years ago, 15 years ago, they're affected, and now there's nothing that we can do about it because that injury has healed itself. Healed as in that scar tissue's formed because they gave up on care, whether it was a PT, whether it was chiropractic early on.
Yeah. So following the full treatment plan is obviously really important.
Yes.
So when you meet a patient and you do your initial investigation, so to speak, your initial assessment of their health, and you make a treatment plan, do you give that treatment plan to your patient and say, listen, this is going to be what we're doing? And how often would you say that those patients follow the treatment plan to a T?
There's a lot of resistance. Most of them can follow through with it. But that comes back to that point where they start to feel better. They typically think that I'm good. I don't have to come as often. I'm going to make this a once per week type of thing or once every other week. And is that good? Absolutely not.
Yeah. You just got to do it.
Yeah.
Like you said, just get through the pain, get through the treatment. And on the other end, you're better off.
Yeah.
If you don't, you're just prolonging the issue.
Yeah.
Just making that small part of your life that was painful and frustrating a longer part of your life that's painful and frustrating.
Right. Yeah.
And that leads into another painful thing is the cost of medical care.
Yeah.
Ever increasing in this world, especially up here in Massachusetts. You know, the medical capital of the world, everything's so expensive. You know, and everything is so charged by health insurance companies. People rely on that because healthcare costs out of pocket would be, you know, ruinous.
Right.
So, and of course, every day, health insurance companies are covering less and less and less because the cost is going up. And I have a lot of theories about why that is. You know, I could do probably 3 hours on why health insurance doesn't cover as much as they used to. And of course, why medical costs, doctor's visits, surgical costs, you know, diagnostic treatments, everything is going up so much every year.
Yeah.
I would say that although it's not, you know, it's not like it's cheap, chiropractic is a much more affordable option.
Absolutely.
And it's probably better for you.
Right. So you look at my fees compared to, I mean, geez, take an ambulance ride. What does that cost so much?
Now between $1,800 and $2,500 most times, depending on which city you're in.
Okay.
You know, you know, if you get the, you know, get the local fire department ambulance to take you, they're required to have 2 paramedics on board. That's probably a $3,000 ride.
Yeah.
You know, if you get a private ambulance company that picks you up, that they're not required to have that level of care on board, then probably a little cheaper, but it's not cheap.
No.
You know, it's not cheap. Just the ER visits, not cheap. You know, the whole issue, I mean, and thankfully, most health insurers cover a certain amount of chiropractic care too.
Yes.
You'll find that at least, 12 visits a year usually, right?
Minimum.
Maybe more up to 20.
Yeah. Yeah.
And so you might be able to knock out on most of a treatment plan with health insurance.
Good amount of it. Yeah.
No, honestly, if you get in a car accident, it's mostly covered by car insurance.
Yeah.
Your health insurance will play a factor in that, but initially the car insurance will cover the chiropractic care.
Yeah.
And then your health insurance will cover some of it. So really you're not paying out of pocket at all.
Right.
Maybe some copays.
And even from a fee for service perspective, chiropractic rates are typically less than, going through all the waiting anyway, and going through the pain management, going through the PT, and is it proper for your spine? If you're in those types of scenarios where, say at PT, they're only treating one injury, if you go to a chiropractor, we're thinking whole body. So we're adjusting neck, mid-back, lower back, shoulder, doing some form of modality type of treatment, whether that's, manual therapy, electrical stimulation, and then throwing in exercise. There's some basic exercises. A lot of people have the impression that chiropractors don't know extremities or like how a shoulder works, but being that it's so connected and intertwined with the upper body and the spine and the neck, we have to know that. Isn't it impacted when we're slouching forward? Absolutely. So,
yeah. I mean,
going on a tangent.
Is it ever? Everything's connected.
Yeah.
If your neck is bothering you and your head's tilted to the side a little bit because it's bothering you, then it's going to pull on your right shoulder. It's not complicated.
No.
And if you're compensating for your injury in one way, you're affecting another part of your body. That's not complicated.
No.
Lay people, idiots like me can understand that. I'm just a dumb lawyer. Yeah, I get it.
Yeah.
So it's crazy. But the sort of secret part of the industry that no one talks about is like how beneficial chiropractic care is for someone who's in a traumatic car accident, and then conceive how much more affordable it is.
Yeah.
You just look at the bottom line. Everything's more expensive everything else is pretty much more expensive. It's incredible.
Across the board. Yeah.
And of course, you also work with other professionals like massage therapists and stuff like that. That assist you.
Massage therapists, PTs that I refer out to, mobility specialists, these people that have been in injuries for over 8 months are going to massage therapists and actually gaining a lot of movement back. And along with the chiropractic care that we're doing, they all intertwine very well. So in the healing process, massage therapy, strengthening through PT, chiropractic, it all goes hand in hand.
And when you make a treatment plan, you include those types of referrals for other professionals. You work with them.
Correct. Yeah.
So it's not just someone coming to you and getting chiropractic care. You recognize, okay, well, I've assessed this patient. I need to, bring in an alignment person. I'm sorry, what'd you call it? Mobility person, or massage therapist, or a physical therapist, or something else.
Right. If they're going to see some benefit, in an injury that has taken place so long ago, maybe chiropractic isn't what's going to get them over that hump, but it's going to help them supplement that care along the way. So typically massage therapy can really help address that.
Right. Address those soft tissue injuries.
Yeah.
Those minor nothing injuries.
Those minor year-long,
traumatic, injuries that affect your entire body and every single, activity of daily living you're doing, from washing your hair to washing your hands to going to the bathroom. You can't do any of it because your body's in so much pain, but it's so minor.
Right.
That those insurance companies have to pay you less, obviously.
Yeah. Another thing that happens with these soft tissue injuries is it becomes so much more difficult to sleep. If you lack sleep, think about how that affects your next day. Think about how that affects the pain the next day. So, in your case, going back into the office, imagine just sitting down and not being comfortable, going home, trying to sleep, and not getting enough sleep.
Oh man, I'm already pretty surly, so I would hate to see what it looked like if I wasn't sleeping.
I would never ask you to do that.
Oh man, that's funny. Yeah, I mean, if I had feelings, like they'd be hurt when people tell me that I'm difficult. I don't have feelings, thankfully.
Good for you.
Yeah. But no, I can imagine, not sleeping. Sleep deprivation is a torture technique.
Yeah. Right.
You know, they actually use it to torture people. They actually use it for, you know, to get information out of people. Like the government uses this against enemy combatants to drain them to the point where they just give up information and people, and you know, it's incredible. And then no one recognizes, like, oh man, maybe the fact that I'm not sleeping every night's affecting me on a day-to-day basis.
Who would have thought? Who would have thunk?
Crazy. So tell me, first steps after it, like you're injured in a car accident, say, from your perspective, first steps. Forget the legal stuff. I covered that in other videos, and we can link those here. But tell me through the medical steps that you should take when you're in a car accident.
So initially, when I have a patient come in that's been in a recent accident, usually that requires sending them out for x-rays. While they're in the office, we'll do orthopedic tests, neurological tests, range of motion tests, just to get a baseline. You need to know what normal is for range of motion, and then compare that to what the patient has. So we look into the orthopedic test to test those soft tissue injuries. That tells us what's injured, how much it's really injured too, as well as the neurological tests that get into, you know, whether they lose sensation, whether they have any weakness or strength loss. Those are all hugely important. But my initial steps are, depending on the accident, depending on the mechanism of injury, it's usually a referral to for x-ray to see if there's any deeper soft tissue injury. And that will let us know that, you know, this is really unstable. So this is how we're going to treat this patient.
Okay. What are some common mistakes that you can tell the listeners today to avoid? Like, let's say you're injured in a car accident or a work-related injury, a slip and fall, anything. What are some common things that you see that you wish your patients would avoid doing?
I mean, I'd say don't hesitate and go to your chiropractor.
Yeah, go early.
Well, it's a slip and a fall. You're still stressing your body. You're throwing yourself out of alignment. You're injuring tissues, whether that be, you know, you usually know when you're affected by a more traumatic bone injury, hard tissue injury, but that can really play into, you know, the soft tissue aspect of it too. So go to your chiropractor, check that range of motion, check those neurological signs, orthopedic tests to verify what injury it might be, or what tissue is injured, and then, you know, come up with a plan from there and listen to them.
Listen to them. That's a big one. Yeah. Listen to them. Don't listen to insurance companies either. Health insurance companies, car insurance companies, comp insurance companies. Listen to your doctors. Do the treatment you need. All right. So I think, just summing this episode up, it's really important. The theme here, okay, is that soft tissue injuries are not minor. They can be major injuries. They can dog you for months, if not years.
Right.
Is that fair to say?
Yeah, absolutely.
And one, you know, sort of trick of the trade here, one like unknown game-changing tip for when you get in an accident or you slip and fall or you hurt at work is, yeah, okay, if you want to go to the ER, obviously, because your injury is significant, whatever. Yeah. But it's okay to go to your chiropractor early. Yeah. You don't have to wait till later.
Don't wait till you think it might wear off or the pain might wear off. Usually there's some adrenaline associated with that too. But yeah, don't hesitate. You know, and you go through these daily tasks of repetitive stress, or whether it be an accident or a trauma, you know, but the body's stressed no matter what, in whatever repetitive movement that we're doing.
And chiropractic care is the manipulation actually of the body and the movements, right? And the flexibility of it and the alignment of it.
Right.
It's not shoving drugs down your throat. No. Which is, I think, all too common in the medical industry these days.
Yeah.
Oh, you're hurt? Here's some pills, right? Rather than here, let's heal your body, right? I mean, do you disagree?
No, I think that was one of my things I shared in the early days of our networking.
Yeah.
You know.
Yeah.
a chemical response or a drug, whether it be a lead, Tylenol, whatever, is not the same as a mechanical problem. A mechanical problem can't be fixed with a chemical solution. It needs to be fixed mechanically, whether that's the healing of the soft tissue or, manipulation or adjustments of the bone to help those joints move in a proper manner.
Think of a car.
Yeah.
Yeah. Right. Car's got a mechanical problem.
Mm-hmm.
You don't just add lubricant.
Mm-hmm.
You need to fix the mechanical problem.
Right.
Right.
You don't turn up the radio, right?
Right. That's not it. You don't treat, as you said, an actual structural issue with just something that masks it temporarily. No, that's not fixing the problem.
No,
that's just masking it.
You're masking the pain.
Right. Crazy. I mean, the industry the way it is today, I don't think people are healing. No, they're just not healing because they're not going to chiropractors. They need to. What don't patients know that you wish you could scream from the rooftops? What is that game-changing, I can't believe more people don't know this. Mm-hmm. What do you want to share with people? Mm-hmm. Tell us.
I think the main thing that comes to mind is that we're stuck in a world that requires us to have these instant fixes, whether that's medications, drugs, whatever. And there's always a need for those types of things. But on the backside of that, in the long game of that is, there's no instant solution to everything it's never gonna fix the problem, right? So again, it kind of goes back to the mechanical problem. If there's a mechanical problem, fix that with a mechanical solution. So from my perspective, it's just let's get the body working properly and know what that feels like for a lot of people. And then go from there. A lot of people are content and comfortable with living their life in pain. Do you know what it feels like to not wake up with pain? Do you know what it feels like to do things with your kids without pain? Do you know what it feels like to, drive your car without pain? Because people are limiting themselves in so many different ways or relying on medications to numb the symptom or numb the pain. But finding the root cause of the problem can open up doors that a lot of people haven't experienced yet.
Awesome. That's obviously sound advice. Mm-hmm. I might want to put that on a poster and yeah. Post it up in the office somewhere for clients to see when they walk through the door. But all right, Jason Grimard, thanks for being here.
Thank you for having me.
Yep. This is Behind the Bar. If you want to learn more about behind the scenes of the personal injury industry and the associated industries that intertwine with it, come back and subscribe to Orlando Associates PC's YouTube channel and to Behind the Bar podcast and learn more. We're going to have more professionals on that touch our industries or that work with our industries and help clients like the clients that come to Orlando Associates. So thanks for watching and go get some chiropractic care.